Let's start with our first section of the lecture, Deaf Child, in which we will discuss the etiology. While talking about the etiology, we will discuss the overview of deafness or deaf child. Then we will talk about some causes of deafness in the children, which might include prenatal causes. Prenatal causes are the causes before the birth, prenatal. Then we will also talk about some perinatal causes of deafness. Perinatal is the period around the birth, some time before and some after the birth. So it's the period that covers around the birth period time. And then we will talk about some postnatal causes of childhood deafness, and in the postnatal is the time after the delivery. So all three periods we will talk about what are the causes of deafness in these three time periods: prenatal, perinatal, and then postnatal. So first, what is the deafness, or what's the definition for the deaf child? So deaf child is the child who have profound or total deafness, and usually children who have total deafness, they fail to develop a speech. For development of language and speech, it's important that the person's hearing should be normal, and then they can hear accurately and completely. Without that, so the deaf child usually have no speech develop and no language develop. So profound or total deafness, child fail to develop speech. And usually the term used for these children is deaf, mute, or deaf and dumb. And these were little older terms, still used also, but now the preferred term is usually, it's better to use the term hard of hearing, or instead of deaf, mute, or deaf and dumb. So deaf child is the child who can not hear properly, or total deafness, and when they have total deafness, these children fail to develop speech. The etiology or causes of the deafness in children, we have causes associated with birth, we have prenatal, then we have during birth, perinatal, and then after birth we have postnatal causes. So the causes of deafness in children or newborns is mainly associated with three time periods. We have prenatal causes before the birth, and then we have perinatal during the birth, and then we have postnatal causes after the birth. Natal is the time used for the delivery or birth. So pre means before, peri is around, and post is after the birth. Now, some prenatal causes of deafness in children, we have usually, we divide it into infant factors and then the maternal factors. We have infant factors that can cause deafness, and then maternal factors that can lead to deafness. Infant factors can be genetic or non-genetic causes. Genetic is that they run in the family, and non-genetic is they don't run in the family, and it's independent of the familial history or cause. So it can be genetic reason of deafness, or it can be non-genetic cause of deafness. Usually the infant factors involve membranous labyrinth or both. The inner ear is the main part of the ear that is affected when there is complete deafness, and then complete loss of hearing. So deaf child usually, or deaf individuals, they have involvement or abnormality of the labyrinth. Labyrinth is the term used for inner ear, and the labyrinth is membranous labyrinth or bony labyrinth. The abnormality is mainly of the membranous labyrinth that have the cochlea. Then we have in the vestibule we have saccule, utricle, and then we have the 3 semicircular canals. All these are the structures that make up the membranous labyrinth. So here if you see, this is the semicircular canals. Then we have saccule and utricle, and this is snail-shaped structure is the cochlea. So mainly is the abnormality of membranous labyrinth or both, membranous or membranous bony labyrinth. Some abnormalities that can occur in membranous labyrinth and that can lead to the hearing loss. We have some dysplasias in which we have Schäbe dysplasia. This is a German word. So this is the dysplasia in which there is involvement of saccule and the cochlea. So there is dysplasia or abnormality in the saccule and cochlea leading to hearing loss. Another dysplasia, we have Alexander dysplasia. This is a dysplasia in which the only the basal coil of the cochlea is present. Again, in this, cochlea is affected. So we have Schäbe's dysplasia, then Alexander dysplasia, then we have Bing-Siebenmann dysplasia. It's another type of dysplasia in which membranous cochlea is affected. Then we have Mitchell aplasia. As the name shows, aplasia is complete absence or failure to form. Very, very serious form of hearing loss, Mitchell aplasia, in which there is complete absence of development of membranous labyrinth. So Mitchell aplasia, A is absence, aplasia is absence of in this development of membranous labyrinth. Then another is Mondini dysplasia. Mondini dysplasia again is a very severe type of dysplasia in which both the membranous and the bony labyrinth is affected and cochlea is not developed properly. Enlarged vestibular aqueduct is another abnormality, and then there is abnormality in the malformation of semicircular canal. So these are some infant factors leading to the deafness. Infant factors, we have the factors can be genetic or non-genetic, and then mainly involve membranous labyrinth, but can also involve the bony labyrinth. And we have different dysplasias that affect the membranous labyrinth, leading to the deafness in children. And these are all the causes of deafness as a result of infant factor. Next, we have some maternal factors that can lead to deafness. And in the maternal factors, infections during pregnancy are very, very important. Different infections like toxoplasmosis, cytomegalovirus infections, then all other infections, mainly viral infections, can cause deafness in the newborn baby. Then the drugs, different drugs, if used during pregnancy, can cause deafness. These drugs are mainly known as the ototoxic drugs, means they are toxic to the ears and they can affect the hearing. And usually the aminoglycosides and drugs like that, gentamicin, they can cause deafness. Then we have radiation. If mother is getting radiation, especially during the first trimester when the organs are developing, that can lead to deafness. Then we have some other factors also that can lead to deafness. Mostly we have some diseases like jaundice, then the diabetes, all these can lead to deafness. If you see, other factors also include like iatrogenic causes. Iatrogenic when they are the problems which are self-induced as a result of some procedure that is performed. So iatrogenic might be after the amniocentesis performed. It's a procedure in which amniotic fluid is removed from the uterus. Around the baby there is a fluid known as amniotic fluid, and removal of that fluid can induce infection inside the uterus and cause different infections. Infection can also be ascending infection from the cervix, vagina, and that can cause different infection in the baby or the uterus. So all these are different causes, maternal factors that can lead to deafness in the newborn baby. Now, there are some syndromes associated with hearing loss, and these syndromes present other features also. Syndrome is a combination of different presentations or different signs and symptoms, in which one of them is the deafness. So these are some common syndromes associated with hearing loss. The most common autosomal dominant syndrome is known as the Waardenburg syndrome. Waardenburg syndrome is one of the most common autosomal dominant type of inheritance, and it's very common syndrome associated with hearing loss. Usually hearing loss in Waardenburg syndrome is unilateral, or it can be bilateral sensory neural hearing loss. It is congenital and it's autosomal dominant. Then another type is Usher syndrome. Usher syndrome is most common autosomal recessive type of syndrome in which there is hearing loss, and the hearing loss in this is again sensory neural hearing loss. Onset is delayed, and then it's autosomal recessive disorder. Another type of syndrome is Jervell and Lange-Nielsen syndrome. Again, sensory neural hearing loss. It's congenital disorder present by birth, and it's autosomal recessive also. Then Pendred syndrome, again, sensory neural hearing loss. It's congenital, autosomal recessive. Alpert syndrome, sensory neural hearing loss, and it's a delayed onset. It's autosomal dominant or X-linked disorder. Then we have Treacher-Collins syndrome. It's conductive deafness. It's congenital and it's autosomal dominant. So most of it is a sensory neural hearing loss. Most of these syndromes affect the inner ear or labyrinth and the nerves, and when the inner ear or nerves are affected or involved, it can lead to sensory neural hearing loss. Then another syndrome is Croson syndrome, which is again conductive or mixed, congenital, autosomal dominant. And Apert syndrome, there is fixation of the stapes and it's autosomal dominant. So all these are the different syndromes in which one of the feature patient present with is the deafness. Most of these are congenital, but only one or two, few are, they have a delayed onset. It's not, the onset is not at birth, or it's not congenital onset, it's a delayed onset. Then some other syndromes, again, we have Klippel-Feil syndrome, mixed hearing, or it has a mixed or sensory neural. It's congenital autosomal recessive. Then we have Wilder-Wang syndrome, sensory neural, congenital, it's X-linked inheritance. Bronchio-otorenal syndrome, it's conductive or mixed, congenital autosomal dominant. Stickler syndrome, conductive or sensory neural hearing loss, it's delayed onset autosomal dominant. Van der Hoof syndrome, conductive or mixed, delayed and autosomal dominant. Then we have Pierre-Robin sequence, again sensory neural hearing, conductive loss, and it's autosomal dominant. And then Goldenhar syndrome, mixed or conductive, congenital, autosomal dominant, or sporadic extra chromosome multifactorial. And then the Down syndrome is, in the Down syndrome, there is conductive deafness, it's congenital, and there is one extra chromosome in the Down syndrome. So all these syndromes, they have association with hearing loss. So hearing loss at birth is very, very common. It's not an uncommon condition. Different factors, factors of the infant, factors of the mother, and some also congenital factors can lead to deafness in children. Then some perinatal causes is anoxia. Perinatal causes are mainly associated with during the delivery, and different factors can affect the during the delivery method of delivery, and then if there is any hemorrhage and placental disorders, long duration of labor, all these factors at the time of the delivery or birth can cause deafness in the newborn. So very important perinatal cause is anoxia, in which there is decreased supply of oxygen, decreased blood supply, and this can cause damage that can ultimately lead to deafness. Then prematurity and low birth weight infants can have deafness. Birth injuries can cause deafness. Any birth injury, especially if it's an assisted labor or assisted delivery, use of clamps can cause injuries during the birth that can cause deafness. Neonatal jaundice also can cause deafness. Then neonatal meningitis. Meningitis is inflammation of the meninges, which are the coverings that covers the brain and the spinal cord. Inflammation or infection of the meninges can spread to the brain and cause damage of the different structures, leading to deafness. Sepsis, when the infection reaches the blood, it causes sepsis or septicemia, and then ultimately that infection can cause serious abnormalities, including deafness. And then the more the time spent in neonatal ICU or intensive care unit, different factors can lead to in prolonged time in NICU, and then more on the mechanical ventilation, more are the chances for developing problems like deafness. And all these complications we talked about, like anoxia, neonatal jaundice, neonatal meningitis, septicemia, all these can lead to increased duration in the intensive care unit. Ototoxic drug like we mentioned aminoglycosides, they can cause also deafness. Then some postnatal causes after the birth. It can be genetic causes like familial progressive sensory neural deafness. So after the birth also some genetic factors can cause deafness, including progressive sensory neural deafness. Slowly progressive if it's in the family. Then there is some association with syndromes like Alpert, Klippel-Feil, and Hurler. And we already talked about all the syndromes that can lead to hearing loss. Then some postnatal non-genetic causes include viral infections, secretory otitis media, ototoxic drugs, trauma, and then noise-induced deafness. So the postnatal causes of deafness can be genetic also, which is late progressive familial type of deafness. And then we have non-genetic like infections, any otitis media, ototoxic drug, any trauma that can cause injuries or fractures of the skull can cause deafness, and noise-induced deafness can also occur. So that was all about section 1, in which we talked in detail about the overview of the deafness in child, and then also what are the prenatal, perinatal and postnatal causes of deafness in children and syndromes associated with hearing loss. Thank you for watching sqadia.com.